Hi, this is Dave here from ProSport Physiotherapy, and what I would like to talk about today is knee osteoarthritis and just give you some nice simple exercises that you can be doing to help your pain if you've been diagnosed with this. Now, knee osteoarthritis is basically a degeneration of the cartilage that kind of lines the surface of the knee, okay, or it may be just kind of the traditional wear and tear you might have heard around the knee joint. Now, the first thing I'd like to say with knee osteoarthritis is that actually a lot of people will have wear and tear in their joints. So this kind of term is being thrown about very easily these days, where, you know, if you have prolonged knee pain and you're at a certain age, you know, or you've had loads of surgeries, or, you know, you've had a few knee injuries in the past, you know, then we're tending to diagnose these as osteoarthritis very quickly. So that's the first thing, is just take caution when you do get that diagnosis, okay, because very often it can be something else, okay, that, as I said, if we can't get rid of this pain, then, you know, and we see something on the scan, we're very quick to diagnose it as this. Now, sometimes there is wear and tear on scans, and the one thing that we need to understand with this is that wear and tear doesn't necessarily mean you have to have pain. So when I work in rugby league and I work with rugby players and rugby union players, when we scan their knees, a lot of them will have this wear and tear, and they're absolutely pain-free in particular parts of the joint that surface appears to be or should be symptomatic. Okay, so the first thing to note is that a lot of people that are walking around now will be absolutely pain-free, yet if we brought them in and we scanned them, they'd show wear and tear and degenerative changes in the knees. Degeneration is just a part of life, okay? As we go through life, we're going to develop this wear and tear, but it doesn't necessarily mean that we have to have pain. Now, there's one important other thing before I give you some exercises, is that there's research out there showing that when we have arthritis or osteoarthritis, that we can get the tissues around the knee can become a little bit sensitive, okay? So what actually happens is that when these tissues get sensitive, they have specific messengers that send messages up into the brain, and then the brain interprets this information and then sends this ultimate knee pain output. So pain is an output of the brain, in that we get messengers, you know, all around the ligaments and the capsule of the knee. These messengers are sending signals up to the brain. When certain messengers send certain signals, then the brain usually goes, okay, we may be in danger here. We're going to send pain, so that you, Joe, Jane, John, Joe Blogs, whoever it is, actually feels the pain and takes action, okay? So pain doesn't necessarily mean damage. Pain, most of the time, is just telling us to change something or do something about it, okay? Now, unfortunately, if we just rest, our bodies don't like that, okay? Our bodies loves change. It doesn't like doing the same thing over and over again, or it doesn't like being kind of laid. It loves load, it loves stressing the tissues, okay, because the tissues are very durable and they can adapt. So if we give the body the right stresses, we can change the messages that are going up to the brain from these particular tissues, okay? So there's some research at the moment suggesting that actually there may be an interpretation problem in the brain with osteoarthritis, and that's very important. So if we can give the brain the experience of new movement options, and we can give it the experience of moving this knee pain free, then all of a sudden these tissues will be given new messages up to the brain, which can just disrupt that pain output, okay? And that's the first part, that if you've had long-standing knee pain, we may need to look at other parts of the body as well, and not just the knee. Okay, so that's the kind of messengers, and that's very important. The next thing that we can influence is the tissues that insert into the knee. So all the quadricep muscles attached via this common tendon down, you can see past the femur into the tibia here. So when the tone of those tissues get a little bit tight, that can just put a little bit of pressure on the knee joint as well. So some hands-on treatment to particular tissues can just decrease the tone of those tissues. Then we can give you some very specific rehabilitation exercises to change the tone of these tissues. It gives the brain that feeling of confidence again, so that it doesn't have to have this protective tension almost, if you will, okay? So that's the next thing, is that we can actually change the tone around these tissues, but we have to be very smart in how we do that. Now, Everybody is different, and based on your injury history, the particular fibers, okay, or the particular directions of force that we want to put through the knee will be very specific to you. So I wish I could say everyone needs to do this exercise, and I will give you exercises in a second that are very useful for the generic population. But for the nitty gritty, the local treatment of these tissues, then we need to be very specific to you. And unfortunately, that we need to assess you, and we need to actually go, okay, this is exactly what you need, and this is very specific and individualized to your treatment program. So although we might have 5 patients with osteoarthritis, the treatment and rehabilitation program has to be specific to you. So we can't just give you cookbook recipes and cookbook exercises. It needs to be very, very specific. So the other thing though that we can do is we can give the brain confidence. So we can actually start to use this knee again in different ways, okay? So we can give the brain new movement options, which just gives that brain a change of input from that constant danger, danger, danger signal that's coming up from the tissues to actually, this is new, what's this? Okay, so we're recruiting different receptors, we're recruiting different messengers depending on the way we move the knee. That gives the brain, okay, this area here has a special part in the brain. When that area in the brain lights up when we move the knee now, there's different messengers giving the signal. So then we can just change that interpretation, okay? And that takes a little bit of skill. It takes a little bit of load management, a little bit of exposure to certain stimuluses and stresses, but it's very, very achievable because the brain can change, okay? We know that it's got great plasticity in that we can give it stimuluses and we can undo stuff as well, okay? We can restore movement, we can restore that feeling of living pain-free again with this knee pain. Okay, so we're going to move on now, and I'm just going to give you a very, very nice exercise just to give the brain new movement options and just to change your brain's perception of how this knee moves. Okay, so all we're going to do is we're just going to start to allow our brain to trust the leg again. So all we're going to do is we're just going to stand. If we were standing shoulder width apart, we're going to put one foot about a foot in front of the other foot. Now that's just going to challenge our base of support, and all I want you to do is just slowly allow your body weight come forward and back. Now as your body weight comes forward, okay, I don't want to just see moving the knee, okay, so I actually want the hips to come forward and back. Now the slower we do this, the slower that we're going to give the brain an opportunity to make some fine tuning, okay? So if we just fly through this, chances are the brain's not going to learn much, okay? It's not going to be too worried about it, it's not going to take notice, so it'll probably just give the same pain output that we usually had. Now if we go super slow and we just allow our body to go really, really slow and adapt to this, and actually you feel the different pressures in your foot, you feel the different muscles that have to work, that can give that information up to the brain and just help change the interpretation. So one thing you should notice as your hips go forward is that there's quite a bit of pressure going through the foot into the floor. Now research is suggesting that people with osteoarthritis, that a lot of them lose that pressure through the foot. Okay, so if we go slowly here, we can get more pressure through the foot, which can hopefully help strengthen the muscles, allow the body to build tension that little bit easier and transmit forces away from the knee down to the Achilles tendon and to the patella tendon. So we use elastic energy, so we start to feel a little bit lighter. And that's all we're going to do for the first bit, is be real disciplined with the speed of the movement. Now the next thing that I'm going to get you to do is I just want you to reach this left hand down towards your left knee, okay, as your hips go forward. What that's going to do is that's just going to slide my pelvis slightly over. Okay, now that you should feel a reaction in the foot, so there should be different pressures going through the foot now, and that's going to recruit different motor units of the muscles around the knee, around the calf and around the foot. Okay, so now we're just teaching the body that if I have to reach over here, we're stimulating all these tissues on the lateral hip, we're stimulating all the tissues in the knee to react. So instead of just keeping the knee over the second toe all the time like you might have been taught, we're actually allowing the knee to twist slightly and the muscles are decelerating that motion. Again, we're going very slow, we're not going into pain, we're just letting it experience these new movements. Okay, so just do that really slowly. Again, make sure that your hips go forward as you reach back. Okay, you should feel a slight stretch now in the hip as well. Now, if you go for a walk now and just move around for a little bit, you should start to feel a little bit different, that the tissues are getting a little bit more efficient at using elastic energy. You should almost just feel that little bit lighter, okay? So you're just going to repeat that on the same side or on the opposite side. So we're just going to put a foot in front and a foot apart, and then we're slowly going to go forward and back. So if this side is asymptomatic, does it feel any different? Okay, and again, keep the discipline, going really slow, okay? Fighting the urge just to fly through it. As I said, the brain won't learn anything. We'll be using fast twitch fibers, which isn't really ideal for this kind of particular motion, okay? So once you're happy with that, you can get the awareness through the foot. Then we're just going to reach that right hand down towards the right knee as our hips go forward, okay? So that's just going to get a slight twist in the knee, which is going to recruit different motor units around the knee, okay? So instead of using the same motor units and getting the messengers giving the same response, we're stimulating different motor units now. So that area in the knee is getting stimulated in the brain with different motor units, okay? So it's just changing the interpretation of the brain by giving this knee more movement options, allowing the tissues to do their job, okay? So that's it. It looks very, very easy, but if you do that very, very slowly and you increase your reach as time goes on, you'll see that the pelvis will start to move a little bit more and you'll start to feel a little bit springier. Okay, so that movement combined with some hands-on treatment and then some very specific exercises that you need based on your injury history can make a big, big difference to the interpretation of the pain, okay, and also the pressure that's actually going through the knee and the direction of the forces that we're putting through the knee as well. Okay, so if you have any questions, don't hesitate to get in contact, or if you'd like an individual assessment, then obviously feel free to use the forms below.